Hi, I'm going to talk about the latest outcomes of randomized trial of high-frequency oscill in neonates. Okay. The respiratory failure remains a leading cause of death among infants. Intensified conventional ventilation frequency and higher pressures airways result in a higher incidence of bowel traumas. The ventilations with high frequency oscillations can offer a solution to these situations. Ventilation pressure oscillation high frequency allows gas exchange in the lungs in spite of reduced tidal volumes. The effectiveness of high frequency oscillations is mainly due to the improvement in pulmonary gas exchange.
Hi, I'm Stephanie, and today I want to talk about high-frequency oscillatory ventilation and how to set up the oscillator. The oscillator is used for pulmonary conditions that have a very low lung compliance, such as like infant respiratory distress syndrome. There are a few differences between the oscillator and just a regular conventional ventilator. One of those big differences is that the oscillator uses over 150 breaths per minute, whereas the conventional ventilator usually uses a rate of 40 to 60 breaths per minute on infants. The other difference that is very important between the oscillator and the conventional vent is that the tidal volume being delivered by the oscillator is a lot smaller than the dead space it has to go through. This whole arm is dead space. When setting up the oscillator, the first thing you want to do is plug it into the electrical outlet along with the oxygen and air hoses. The next thing you want to do is to turn it on. Then you're going to pick your settings. Your FiO2, your mean airway pressure, your piston placement, your amplitude, inspiratory time, frequency, and your alarms. Your
Okay. The results from an observation study conventional involving neonates suggested that high frequency oscillatory ventilation, this is HFOV, as compared with conventional ventilation, was associated with the supraosmotic airway function at follow-up. Data from randomized trials are needed to confirm these findings.
This is Mark William Rolfe, Associate Professor of Internal Medicine and the Medical Director of the Adult Cystic Fibrosis Program at the University of South Florida School of Medicine, Tampa, Florida. Flexible fiber optic bronchoscopy is a procedure routinely used in the evaluation and diagnosis of airway diseases. It has been used extensively in clinical research into lung disease. In the situation you are about to see, bronchoscopy is being performed on a 26-year-old patient with cystic fibrosis. The patient is undergoing this procedure with the vest in place. After topical analgesia and intravenous sedation is administered, the bronchoscope has been advanced through the posteropharynx, through the vocal cords, and into the left lower lobe bronchus. The small insert frame in the lower right-hand quadrant of the screen shows the main carina and proximal airways as the bronchoscope enters the left lower lobe. The airways are mildly to moderately inflamed. The main screen image depicts airway secretions as the vest is activated. The oscillations of the vest are seen as they are transmitted from the chest wall through the lung parenchyma and into the airways themselves. Almost immediately, mucopurulent secretions are seen to well up from the lower segmental bronchi. The secretions ebb and flow from these bronchi with the patient's spontaneous respirations until a cough expels the secretions in the left main stem bronchus, temporarily obstructing the view from the bronchoscope. Once these secretions are cleared, more secretions are then seen emanating from the lower lobe segmental bronchi as the transmitted oscillations from the vest continues. Airway clearance is rapidly being recognized as an adjuvant to standard therapies in a number of respiratory diseases.
Okay, and in the conclusions, in a randomized trial involving children who had been born extremely prematurely, those who had undergone HFOB as compared with those who had received conventional ventilation, had superior lung function at 11 to 14 years old with no evidence of poor functional outcomes. Okay, thank you.